Well, let's start with the issue of the H1N1 because it was something that kind of, for the public at large, was not really on the radar. Because I can't remember even thinking about H1N1, and then I saw that article yesterday, and I said, "What? H1N1?" So tell us what's the status of that in Trinidad at this point in time.
So the Chief Medical Officer will speak in detail about H1N1 and what it means, and I will talk about the policy prescriptions after.
Sure. Okay, great.
Okay, so H1N1 is just a strain of the influenza A virus. So it has been around in the world and in Trinidad since 2009 thereabouts. Has never really gone away per se, but the cases have been sporadic. There have been a few per year occurring since 2009. But it has not been to any epidemic or endemic proportions in the country. Meaning that there hasn't been any outbreak of the illness.
What kind of numbers are we looking at?
Very low numbers. I would say less, in terms of confirmation, less than 10.
Per year?
Yeah, per year.
Yeah. Any fatalities out of that?
There would have been, over the past 3 years, about 2 fatalities related to the influenza virus.
No. What is the outstanding feature of the H1N1 virus as opposed to other viruses that we've had?
Right. So there are many hundreds of viruses that can cause any type of respiratory illnesses. We break it into 2 broad categories. So those that cause basically what we know as the common cold, which is a milder form of respiratory illness, and the influenza virus. Now, in general terms, people use the flu to describe everything, which is not really accurate. The flu is short for influenza virus, which is the more severe form of the respiratory illness, and is caused by basically 3 major classifications of influenza virus. So type A, B, and C. A and B are the ones that are responsible for human disease for the most part. H1N1 is a type of A. So basically what we're looking at is differences between the flu and the common cold. The flu is a much more severe form, as I said. The common cold is what we are accustomed with. Basically you get a very low grade fever or no fever at all. You get runny nose, you get some body pains, usually lasts about a week or thereabouts and resolves on its own. The flu, the distinguishing feature, the main feature, and it's even difficult for physicians to tell the difference in the early stages, is a much higher grade of fever. Tend to get a fever that goes over 38.5, 39, sometimes 40, and it actually happens much quicker. So the distinguishing feature is just the grade of the fever and how quickly the disease escalates in terms of symptomatology. So basically you will have people that are well today, and by tonight you're very unwell, having shortness of breath, having high fevers, feeling lethargic and that kind of thing. The common cold doesn't do that. It's a very insidious onset, and it resolves on its own.
So if I could come in here now, as the CMO has given you the technical explanation, from a policy perspective of Minister of Health, when I would have come into office in September of 2015, the 2 major issues facing me as health minister was 1, maternal mortality and deaths due to influenza virus. For that year, now the flu season runs from October of any year to May of the following year. So it corresponds with the winter up north.
Yeah.
Right? So from October 2015, when I first came into office, people started dying of the flu, influenza A. As a new minister, I discovered that the ministry at that time had a policy of bringing in 12,000 influenza vaccines into the country. Of that, in any typical year, they would give it about 6,000 and destroy 6,000 because it has a very short shelf life. That year, 8 people died in the flu season, October 2015, when I first came into office, to May 2016. I vowed that will never happen again. The following year, we ramped up our flu program vaccine from 12,000 to 100,000 Nobody died in the flu season for October 2016 to May 2017. The flu season, May 2017 to now, October 2017
to May 2018.
to May 2018, nobody died again. Because we ramped it up again to 75,000 doses, and we gave out almost all. This year, again, we have 75,000 doses to give out, but unfortunately, we have had 2 deaths. So
Since
that's
October.
since October of 2018 to now.
To now. Yeah.
So that's what the CMO said. Over the past 3 years, we have only had 2 deaths due to flu. Now, when you look at what is happening in countries like the United States, where they predict, and history will show us, that 50 and 100,000 people die, even though they have a population of 300 million. But that's a phenomenal figure. Long and short, as Minister of Health, we have 75,000 doses of flu vaccines to give out free of charge. I am urging the population to simply get vaccinated.
Who are the people who should
get vaccinated?
Excellent question. And we had a change in policy. When I came into office, I met a policy, which was a good policy at the time, that there were 5 categories of persons that you need to vaccinate. 1, healthcare workers, because they are on the front line.
Right.
2, pregnant women, because pregnant women are susceptible to influenza A and will die if they get it. 3, the elderly, and especially those with what we call metabolic diseases, whose immune system is compromised, so like the elderly with diabetes. So the elderly, people on cancer treatment, whose immune system is suppressed. You do that. And lastly, children between the ages of less than 5 years. Those were the 5 groups that we focused on. This year, we made a dramatic policy shift. This year, especially after the floods, where you had a lot of airborne viruses and bacteria, we made a policy decision. We are going to make it available to anyone, regardless of age, whether you are pregnant, whether you are suffering from diabetes. So, for instance, you 3 gentlemen who before would have been excluded because you are healthy, middle-aged, whatever.
No.
Teenager.
Early 30s, early 40s.
You would not have met the criteria before.
Right.
But we have had a major policy shift this year that we will vaccinate anybody who is seeking the vaccination.
But if you're doing that, 75,000
I was going to ask
too
that.
little.
Yeah, you have to ramp up that amount.
Well, I'll tell you something. And this is where I want Dr. Deyalsingh and them to come in now. People are shying away from the vaccine. It doesn't make sense to bring in 1 million and then you have to dump 900,000. If we need more, we will get more.
Oh, I get you.
Right?
But where
because this costs the taxpayers money.
So I get it. So you would be conservative at this point and see what the demand would be like.
Exactly. But sorry to cut you in. But at this time of the year, with the winter up in the north, and people coming back home for Christmas and Carnival, and bringing the influenza virus with them, it is imperative that citizens of Trinidad and Tobago make use of the free influenza vaccine bought by the taxpayer and government of Trinidad and Tobago.
Okay, now here my question. Where are people accessing these vaccines? And I know, for example, in a U.S. situation, you could have gone to main pharmacy chains, like Walgreens and stuff like that, and you could get your vaccine for free. What's the situation in a Trinidad?
So the CMO could speak to that.
Yeah, so basically we haven't reached the stage of going to the private pharmacies and allowing that to happen as yet. We still want the oversight from the physicians in the country to ensure safety for the population. So they are available at all public health institutions, health centers to the most part, which are primary care institutions. We had last year and the year before, I think we made a provision to have vaccination on special days. So we still do that on Tuesdays and Thursdays. In most health centers, there's a full schedule on the Ministry of Health website as to where you can go and what times you can go to access vaccination.
Now, so for someone like me, who is morbidly afraid of vaccinations,
Why?
I don't know.
And that is the problem we have, that the population is afraid of it.
Right.
And then you want to hold you accountable when someone dies of it.
No, well, all right, I hear you on that. But for someone like me, people like me, are there any side effects to this vaccine at all? Because that will be my biggest worry.
The most common side effects we have seen is pain at the injection site. And
see, there you go, right.
And you would say that you're afraid of the needles more than the vaccine, right?
Yeah.
So it's pain at the injection site. Some people get a very mild sort of post-viral illness that lasts about a day or two, and then that disappears. But that's the most common symptoms that we have. Sometimes a little redness at the injection site as well.
But I would like Dr. Deyalsingh to come in now and speak about the challenges of influenza vaccine and the pregnant population.
But you can go from today at any health center and get the vaccination.
This has been going on since October.
Okay.
We have delivered already for this season 13,000 vaccines. So we're looking at about is gone up. So we're getting about 2,000 people vaccinated per week. Since we started, we're only 7 weeks into the vaccination season.
Well, now that you're on this program, there's going to be a flood of people.
And we welcome that.
And
I thank you for that.
Yeah.
So, well, good morning.
Good morning.
Good morning to your listeners as well. So, my role at the Ministry of Health is really looking after the health of mothers and the newborn babies, and that's my main goal, is to ensure that patients make it safely through pregnancy. So, one of the things I've seen over my career, and I was at the Sangre Grande Hospital as the Chief of Staff before coming into this post, is we actually had that outbreak what Minister alluded to in 2015. We had 6 cases of H1N1 cases who actually passed away. And at that time we had one pregnant woman, and she was extremely ill. They get very, very ill. As we said before, pregnancy is like an immune compromised state here. Once you get ill, it's harder and more advanced in pregnancy. The large uterus, the big belly, makes it harder to breathe and to ventilate those lungs. So they get ill very, very quickly. Within 24 hours, they can go from a very well patient to into an ICU bed.
Wow.
And we were lucky and fortunate that we recognized the symptoms, and we were able to safely deliver the baby and get mother. And they recover fairly quickly because they are relatively healthy after, women we are dealing with. For this year already, we've had at least 3 cases of pregnant women who have made it to the intensive care units. 2 at San Fernando Hospital, where Dr. Sinanan would have spoken on that recently. They were very critical, and luckily both women survived. We have one potential patient right now in an ICU who might be another case of influenza, and we are hoping that she makes it through. In terms of the vaccine can be given at any stage of pregnancy. There's no time. It can be given twice in the same year. If you're pregnant twice in the same year, it's safe. It also gives you protection for the unborn child. So you're not able to give that vaccine in the early stage in the first year of life. So it gives you antibodies to the mother that will protect the baby when they're born. And remember, these babies are very susceptible when they're born as well.
Just sorry to interrupt you, but you said something just now that had me a little curious. You said can you take the vaccine more than once in a year?
You can actually take the vaccine. So the season runs for a certain time, and what WHO does is they issue which vaccine should be given in any given season. For the past few years, we've had the actual same constituents of the vaccine. So the vaccine we use has 3 components to it: 2 types of influenza A and 1 type of influenza B. And they determine that based on geographic region, etc. So WHO issued that for North America, Central America, and Latin America. So we use the same vaccine. But every year we are guided by which vaccine to use based on surveillance.
Let me just come in here because Dr. Deyalsingh touched on something which needs further explaining. Unlike the vaccines that we get for childhood diseases like mumps, polio, which give you immunity for life, the flu vaccine is a yearly vaccine because unlike other viruses, the flu virus mutates or changes every year. So the flu vaccine is a yearly vaccine. So if you got it in any one particular flu season, that only confers immunity for that season. So that is why he said, if you get it in January for this year's flu season, you will have to take it back in December of the same year for the following flu season. Because the flu virus, unlike other viruses, mutates, it changes. So this is a yearly vaccine.
Right. So it's super important then that for all pregnant women listening that they should get that vaccine.
Absolutely. And of course, as we said before, the Ministry of Health has made this vaccine, and it's actually available at every single health center in the antenatal clinics, as well as in the hospitals as well. So we generally have problems getting our women to take vaccines. It's cultural.
It's voluntary.
It's voluntary, but we use as best persuasions as we can. We've had a fairly good response this year as compared to last year. We have about 1,200 women for this season so far in terms of our reports, which is actually, it could be better again, but it is similar to what is observed in the United Kingdom and USA. They have about 40 to 50% uptake of the vaccine, despite they have the same challenges as we have. We're probably looking at as high as 60% this year for Trinidad and Tobago based on our numbers of deliveries for the year.
Here why I ask if it's voluntary. For instance, if a pregnant woman from time to time, they have to go into the clinic to do checkups and so on, right, during the course of their pregnancy. Is it something that will be administered to them at some point in time when they go in for a checkup?
Oh, absolutely. So how we run the health system with the antenatal care is we have a first visit. And at that first visit, we do a lot of counseling and education and what services are available. It's the first time they're probably seeing a doctor or a nurse for their whole life since they were a child. Right. So it's a good opportunity to do health interventions, so one of which is vaccinations. And we have other vaccines available as well that we also do boost of immunity for tetanus and other things like that.
Right.
So, but we have it available. And, well, again, when I came into this post in May 2017, it wasn't so well available in the hospital system. It was something looked at as primary care. Yeah. But we had to ramp things up, so we focused as well on the hospital. So we had a captive audience, and we were able to put that program in place.
Now, one of the things you're also responsible for, Dr. Deyalsingh, is the issue of maternal deaths and so on. And I know that was an issue.
No, he isn't responsible for
you know what I mean?
He's responsible
for eliminating
the significant decrease in maternal deaths.
And I want to tell you,
far exceeding global first world standards.
And I want to tell you that at one point in time, it was a bother in Trinidad and Tobago.
We discussed it several years, different years on this program, and about why our rate was so, ridiculous. So where exactly is our rate now? Because Minister Deyalsingh indicated that he met that it was an issue, and it has improved. So where are we now?
And we did observe that it did improve, but I think at the end of last year, we had a
case
few
on the newspaper. And again, it's a little complicated issue, but just to simplify it, the world reports ratios per 100,000 women. Trinidad and Tobago, the annual delivery rate is around, let's say, 17,000 to 18,000 per year. So every death has to be multiplied by a factor of 6 to 7. It's not actually 6 or 7 women dying. Right? So that's the first part of the confusion. Sometimes we look at 5-year periods, and for this year, we've had 2 women who died from what's called... last year, just passed. Yes, sorry. And they died from what's called direct maternal deaths. These are from causes directly related to pregnancy. There are some women who may die from other conditions. For example, if you had like sickle cell disease or some other condition, and you die from that condition rather than pregnancy. So sometimes we have to clarify the figures. So again, multiplying by the factor, we're looking at about somewhere between 20 to 30 per 100,000 as the ratio for last year. That's our figures. And these are good because the WHO recommends for our region to be under 70 per 100,000. By 2030, we need to get to under 30 per 100,000. So we have an aim to get there, but we have achieved those figures. That's what Minister keeps saying. We've reached the figures way ahead of our targets, which we hadn't done for the last reporting period, which was 2015.
Yeah.
We were in the high 50s and 60s.